All right. So good day, everyone.
Se ve muy
It's
bien.
great. Gracias. Good day, everyone. It's great being able to connect with you
Buenos
all
días.
here today, regardless of where in the world you may be. A warm thank you to the University of Desarrollo for the opportunity to be here with you today. Special thank you to Charla, to Susana, to Andrea. My name is Natalia Romano. Currently, I am a medical student in the United States, studying in Philadelphia. I completed my undergraduate degree at Columbia University in New York. I went on to complete a degree in narrative medicine prior to enrolling in medical school. And as a result, I have brought medical humanities with me to my medical education, and most recently to addressing the COVID-19 pandemic. In my experience and in my scholarship, narrative medicine is a powerful tool to build narrative competence in the clinical space, and more in general, to build community within teams. So in discussing narrative medicine today, my talk will focus on the role narrative medicine has in building community, especially in the COVID-19 pandemic. So in my talk today, I will focus on my experience with Columbia in designing and then holding online narrative medicine workshops, which are free and open to the public. They're still ongoing. I will then conclude with a short take on ways in which narrative medicine has the potential to build community within medical students, and particularly first years. This is a challenging time, and Zoom may not necessarily allow for the typical socializing that used to happen in the past. And so I'll share one way in which narrative medicine can overcome the challenges of this pandemic. I want to acknowledge that there has been an entire team behind making possible the experience I will be telling you about today. So before I begin, I want to give a special shout out to the team at Columbia Narrative Medicine. The names of my collaborators are in the slides. And I also want to acknowledge the hundreds and hundreds of participants who have attended our workshops. We're very close to holding our workshop number 100. And this experience has been made possible by the organizers as well as the participants from all around the world. So whenever in my presentation I will be saying we, these are the people who I'm referring to, because none of this happens in a vacuum and alone. So here we go. So before we dive in, I figured it would be good for us to do a little bit of an overview of narrative medicine. So what is narrative medicine? Narrative medicine is a field within the broader umbrella of medical humanities. Everyone you will ask will have their own definition of what narrative medicine is. This is partly because this is a relatively new field. It's still growing and evolving. It was started in the early 2000s at Columbia University by Dr. Rita Sharon, who's an internist and a literary scholar. The PhD you see on the slide here is a PhD in literature, not in science. At its core, however, narrative medicine is medicine practiced with the knowledge of what to do with stories. In the introduction to the principles and practice of narrative medicine, Rita Sharon writes, narrative medicine began as a rigorous intellectual and clinical discipline to fortify healthcare with the capacity to skillfully receive the accounts of the persons give of themselves, to recognize, absorb, interpret, and be moved by the action and stories of others. With time, narrative medicine has permeated space beyond the clinical space and served many more purposes. In her seminal paper, Rita Sharon talks about the 4 central moments of narrative medicine. She calls them the 4 narrative situations. And as we experienced throughout the workshops that we're holding, it is clear that narrative medicine has the potential to reach far beyond the clinical space and into the world. The original 4 central narrative situations were the clinician and the patient, the clinician and the self, the clinician and colleagues, the clinician and society. And the COVID pandemic has taught us about how everything we know can change and be expanded and applied elsewhere, and the same has been about narrative medicine. So the narrative medicine workshop is one of the signature experiences of narrative medicine. Participants do not have to prepare anything before they come. They just bring themselves. No prior knowledge or preparation is required. All participants have to do is they have to bring a piece of paper, something they can write on, a pen or a pencil. And actually, since we're here, I encourage all of you now to grab a piece of paper and a pen now, if you haven't done so already. I promise it will come useful during our time together today. So workshops are typically 1 hour and a half long, and a workshop consists of 2 parts. The first part is a close reading of a text. The text can really be anything, a poem, a piece of prose, a painting, a song, anything really. What we do is we read it out loud, and then we close read it together as a group. And the second moment is the writing to a prompt. What we do is we do a short writing exercise in response to a prompt shared by the facilitator. We all write in silence for 3 to 4 minutes, which feels like forever, but then it also feels very short. And then we come together to share our writings and respond to each other. We pay attention to the texts that fellow participants share in the same way as we do when we pay attention to a text that we read, whether it's a famous work by a Nobel Prize winner or one of our colleagues. And so this is what we have been doing online since early spring of 2020. The virtual group sessions on Zoom were born in an attempt to foster social connections and offer a space for engagement and reflection during the coronavirus pandemic. These workshops were originally geared towards healthcare workers on the front lines of the pandemic, and we have many in the audience here today. So I thank you very much for your service and your work. However, these workshops were open to the public, free and accessible to everyone, and they very quickly became a space for everyone and everyone, regardless of their role in the healthcare world, to participate. The turnout to our workshops has further proved that COVID-19 in one way or another has truly affected everyone living on this planet, whether they're in healthcare or not, whether they got sick or not, whether they knew someone who got sick or not. All of these initiatives are still ongoing, free and open to everyone. If you would like to participate yourself, at the end of my talk, I will share more information about how you can participate. Typically, we have at least 3 facilitators. 2 are leading the group and kind of engaging with the participants. 1 is taking care of moderating the chat, and others take care of the technology behind the scenes. And as I'm sure many of us have experienced, this new format comes with additional technological challenges. Facilitators are all trained in narrative medicine. They are scholars and practitioners of the field who volunteer their time in a moment that feels like a true ontological emergency for many of us. These sessions started in English, and then they started growing. So we had our sessions in Greek, we had our sessions in Polish, we had our sessions in Spanish, and we had also sessions in Italian, which I was very involved in designing and getting started. So I was involved both in designing and getting started with the English sessions, and I still run them to this day. And then I also worked on adding the Italian series. So my experiences today will be drawing from my time designing and leading the English as well as the Italian sessions. And my talk will also be complemented by the anonymous responses of our participants. We collected these responses through a questionnaire, anonymous, that we share at the end of each workshop as a way of collecting feedback. What will follow is a reflection on our experiences. They are our main takeaways and lessons that we learn from how narrative medicine can help us build community in this truly unprecedented time. And we can divide our experiences as well as our takeaways into 3 moments. The first one is creating space. The second one is, once we have created the space, is taking steps, our first steps in this new space. And the new steps can be whether new steps in a new method, in new steps in self-expression, new steps in self-discovery, It's really been a rich experience for all of our participants. And the third moment is kind of moving beyond that initial self-discovery and recognizing and addressing the other. And something truly magical that we experienced in these workshops was the way in which participants really started interacting and responding to each other. As I said, we are approaching our 100th workshop soon. We have used many, many, many texts in our time so far. Each of the moments that I mention in the slide here and I will mention soon can be crystallized through a few of the many texts that we used through our experience in narrative medicine. So now I'll dive deeper into each of these. So the first moment, as I mentioned, is creating space. Quarantine really hindered our ability to move in the world. It limited our interactions with others. And by confining us in our homes, quarantine, social distancing, physical distancing, lockdown, however we want to talk about them, these measures precluded us from also being able to kind of find our own space and find new space and move in space. And as it was for our Italian participants, for example, by the time we started our sessions in the spring, they had been in quarantine for several weeks at that point. And having spent many, many weeks in their homes, they're really eager to stretch their legs, stretch their minds beyond the confinement of their apartments and their homes. And they weren't only looking for physical space, they were also looking for a space to contact and interact with others. And so one of the first texts that we used was the poem called Spazio by Alda Merini, which really resonated with our participants. In this poem, the poet talks about space. Space, you see it on the right in my slide. I highlighted it in light blue. She says, space, space I crave, all the space, more. Space, give me space, so I may unleash inhuman cries, that cry of silence of the years I touched with my own hand. And this was really an opportunity for many of our participants to explicitly verbalize what was something that they were experiencing for quite a few weeks now. And as facilitators, we became acutely aware that we had the important task of providing space and building space. And in a normal world, what we would do is we would sit in a room in a circle, we would hand paper copies of a text, and then we would read all of those together. This time it was impossible, and we had to adapt to the Zoom format. And so here, what you see projected on the screen now is a slide that we actually project during our actual sessions. On the left, we have 3 community guidelines that we build our space upon. The first one is confidentiality, the importance of protecting the stories and experiences that others share within the group. The second one is humility and an open mind, and really the idea that no one is an expert in this space, and we're all learning and exploring the space together. And then we also felt the need to highlight that these were not therapy sessions, and we were not there in the role of clinicians or diagnosticians, despite many of our facilitators being doctors, nurses, social workers, and so forth, so on. At the end of our sessions, we would always share a series of resources and hotlines that participants could tap into if they felt they needed additional support. And on the right here on the slide, you see a few guides that we provided everyone at every workshop to help folks navigate Zoom. If you all are here today on Zoom, I assume you have some familiarity, but what we try to do is we try to really level the playing field and make sure that everyone has a few rules about how the space works. And a very important tenet of our work has been emphasizing the importance of a beginner's mind. We wanted to make our space as accessible as possible. And so whether we had participants who were absolutely new to the world of humanities, as many clinicians are, whether we had veterans who were expert literary scholars, we wanted to make sure that everyone had the same experience and didn't feel barriers or that they were not adequate in the space they were moving in. And so we asked our participants to practice beginner's mind, a concept detailed by Shunryu Suzuki, who says, in the beginner's mind, there are many possibilities. In the expert's mind, there are few. And so what we would do at every session, and we would ask our participants to set aside any background knowledge or context that they had about the text or the author, and refrain from telling us so-and-so poet was born in so-and-so place, therefore this is what they mean with this poem. We asked people instead to focus on the text that we presented them and to start with the words that they saw in front. So speaking of beginner's mind, now that we had our space, we had to take the first steps. And so in one of our workshops, we close read together this painting by Van Gogh called First Steps. And so the space of Zoom became a space for us to be heard, to be recognized. It also became a space for folks to sort of transgress the strict lockdown measures and take steps and move. And we did that in the narrative medicine space. And in many of the conversations that we had, participants really shared the many firsts of the pandemic. The first time they were outside after a strict lockdown, the first time they considered hugging a loved one after being separated for so long. And one of the first steps that we also took together was in the signature method of narrative medicine, which is close reading. When we bring narrative medicine into the clinical space, we often experience a lot of pushback. There's always someone who says, why should I be spending my time on these soft things? If you're here today, I will assume that I probably do not have to convince you about the importance of medical humanities. However, I do want to share an answer that we do give when skeptics push back. In an early book about narrative medicine, Dr. Sharon writes about the parallels between the acts of reading and the acts of healing. And she talks about really the fact that practicing the act of close reading, the act of paying close attention to words and choices in a text, is practicing for good patient care. And she says when a good reader enters a text, he or she notes and lives by its rules. And similarly, a physician who's well-trained in narrative competence practices the skill of not imposing their reality, not imposing their agenda on the patient, and instead starting by what the values of the patient and the family are, and taking the conversation from there. And so as a group, we took our first steps in narrative medicine and close reading. And what we would do is we would start our conversations by asking our participants about things that stood out to them. And at the beginning, we noticed that as we were moving in the space and taking our first steps, the comments we were receiving from participants were very focused on individual experiences. Each was sharing their own, and it was very clear that this was one of the first opportunities they really had to share their experiences with illness, with quarantine and suffering. And as we went on, participants started shifting in their types of responses, and participants started recognizing and addressing each other. And comments were not only rooted in own experiences, they were also framed as a response to others. And both in the Italian and the English session, we used a poem by Italian poet Montale called Portami il girasole che lo trapianti, or Bring Me the Sunflower so I can transplant it. And this poem, the author reaches to a you, asking to help and transplant the sunflower. And really as we became a little bit more comfortable with our space, we were able to introduce texts that kind of guided the type of responses and the types of interactions we were trying to foster. And among these was the responding and really listening to each other. And while the majority of participants' contributions in the beginning were a way of self-expression and self-discovery, new comments and additions started to referencing what someone else had previously said. And it really became a dialogue. Just like we see in this poem, I highlighted the lines that really implicate the you. The poet says, bring me the sunflower, bring me you, he keeps saying. And so we talked a lot about sunflowers and the fact that while we can all imagine a sunflower, we all view different sunflowers and imagine different sunflowers. And there's as many sunflowers as there are people in our Zoom space. And that was an important realization to come to. And Something we talk a lot about in narrative medicine are attention, representation, and affiliation, which we call the 3 moments of narrative medicine. These are the 3 pillars, and affiliation truly became an important moment for this experience of narrative medicine in the virtual space. When asked to reflect on their experience, many participants said that they were surprised in discovering that other people had extraordinary contributions to make. And all this time they had kind of been caved and closed in their worlds. Many expressed surprise in saying that these workshops helped them recognize the value of contributions others have and paying closer attention and listening before necessarily speaking. They talked about the opportunity to view the world and a text through the eyes of others, discovering new ways of thinking, and how they benefited from just listening to many different voices. And really we were able to have conversations about what it is like to listen to each other and value each other. And we explored this topic in depth, even at one point during an exercise in which we wrote a letter to someone we might have labeled as an enemy, and then responding to that letter in a writing exercise as if the enemy themselves was responding, which is an interesting experience. And so in a world of many barriers, walls, lockdowns, quarantines, and political partisanships, we were able to create a little dent in the wall, just like this book creates a dent in the wall of this sculpture by Jorge Mendez Blake, which is called The Castle. And so here it is again, zoomed out. And so I thought what I would do to conclude is I would try breaking the wall that Zoom creates in this weird quarantine and pandemic world. Instead of describing the experience of using narrative medicine to create community among medical students, I figured we could try to walk through this together. And so I will soon show you a poem that we will use in this, we may use in a session, for example, with medical students. Now this is a perfect time to whip out your pen and paper, shake your hands a little bit, and turn on your reader skills. I will read a poem out loud for you, and I encourage to jot down 3 things that stand out to you from the text. And you'll find the poem in English on the left, and feel free to follow along with the Spanish version on the right. So days, what are days for? Days are where we live. They come, they wake us, time and time over. They are to be happy in. Where can we live but days? Solving that question, bring the priest and the doctor in their long coats running over the fields. So I'll now give you 10 seconds to look back at the poem and write down on your piece of paper 3 words, sentences, or images that stand out to you. And if you feel so inclined, I encourage you to get close to your computer keyboard, your chat, and open that Q&A window, and maybe share a word or a concept or an image from this poem that stands out to you. So once again, if you go on your Zoom bar and you click on that Q&A button, write down a word, an image or 2 that stands out to you. And that is always an interesting experience. What we would usually do in a workshop is everyone would do that. We come together, we ask that people share their text, they share their experience, they share what stood out to them, and we have a discussion about that. And what we do in a second moment is we might use a prompt like this. So we write 3 to 4 minutes, and then we may ask folks to write about the days that brought them here. And in a context in which especially COVID-19 has been isolating and medical students have not been able to really interact with their peers, this is a great opportunity for people to share stories that are meaningful to them and hopefully start a conversation from there. And so this has been a successful exercise time and time over in community building. And so to conclude, in writing about workshop goals, Rita Sharon says that among the results of similar workshop activities are the recognition of emotion, perpetual sharpness, the ability to tolerate uncertainty, decrease burnout, improve healthcare team function, and even just in general, deepening our own knowledge and understanding of each other and just paying closer attention. And so speaking of attention, I thank you for your attention today and for the work each of you does in your respective worlds. I will now share my final slides. Here's my final slide with my contact information. You can reach me via email or Twitter. And at the bottom is also the link, narrativemedicine.blog, to our narrative medicine blog for more information on texts we have used so far and ways in which you can yourself attend a workshop like the one I described to you here today. Thank you so much for your attention, and I yield back my screen time.